Hello.
You can start the session, ma'am.
Hello. Hi. I am. Hello, everyone can see me? Okay, ready. Hello, I am Mini Dimal, a board certified behavior analyst. I'm working in UAE, Dubai. My expertise is in uh, early intervention. I'm working with autistic children and in the field of applied behavior analysis. Uh, can you hear me? Okay, okay, yeah. Um, I'm working in the field of applied behavior analysis more than 10 years, almost like 13 to 15 years now. I'm working mostly with autistic children. Now I am learning acceptance commitment therapy within the scope of behavior analysis, which helps to um, work with the children more in a cognitive level. I can share my slides to show what we are going to talk today. Okay, here we go. So today I'm going to talk about understanding and accepting autism uh, because I picked the topic as in my experience. Many parents, many caregivers, they come across this stage of accepting autism. Though they have a diagnosis, they have the awareness, they have the understanding, but when it comes to the acceptance, it's hard for them, you know. So once they are accepting, they can understand. Okay, I need to go. What is the next level? Right. So I think this is the right topic to help parents how we can take it, what help we can give, how we can advocate for our children. Okay. So you can ask me questions. I would like to answer you towards the end. So end of the our presentation. Yeah. Here. So as I said before, this awareness is enough. Awareness is very important, but it's only awareness is inadequate to address the personal and social experience of an autistic person. So still we keeps under the judgment and discrimination, right? So awareness is needed, understanding is needed, but is the understanding is enough? Everyone knows about what are the symptoms of autism. It has difficulty in communication, social interaction, and it has restricted repetitive interest and behaviors. Maybe it is accompanied by sensory issues, other comorbid conditions. There are different levels of autism as per the support requirement. So all this is all heard a lot. And this helps us to understand it. But still there are denial of the situation. Sometimes we defend ourselves. Sometimes we compare our children to other children. There are a lot of questions why this has happened. We expect a lot more than it could be. So we need to, so maybe their parents can always ask many questions like, is it my fault? Is the doctor is wrong? My child will outgrow this condition anytime soon. Is it because of my child is watching a lot of TV? Is it because my child is not interacting with a lot of people? Because most sometimes the child is living only with parents. There is no extended family. Here in Dubai, many parents go back to their home country. Just they think that because of that, if they go back and stay with the extended family, they and the child will be fine. It's there is a reason of more interaction will help them, but it's not just that's the reason why the child has autism. So accepting the situation is not easy. The journey is not linear. There are emotions, feelings, guilt, questions, getting lost, grief, all this mixed feeling. I would say acceptance is not just a slogan or a hashtag. And when we have the diagnosis with autism, when we know that our child has autism, it's okay to be sad. to feel lost, but it's okay to share your grief with your partner or a trusted friend or a therapist or a family member. So journey autism is always starts with uncertainty, with fear, with resistance, with grief, but there will be hope and there will be love. So acceptance is the first step to start the journey, right? It involves the understanding of autism as more than a label. When your child is diagnosed, it's a label. But what we need to work on is we need to work on what is our child needed, what kind of treatment we needed. Mostly it should be individualized treatment. So, and it should be a gateway to support the acceptance. Accepting the situation gives a new voice for the parents to speak up for their child, to stand up for their child, and communicate to care providers, to do assessment, set goals, start early intervention. Just because sometimes the parents are not or caregivers are not accepting, they delay the treatment. They said, okay, it will be fine. My child has just speech delay. Maybe after 3 years or 4 years, they will start speech. So that sometimes that delay can cause the child to have difficulty in communication and negative behavior. So acceptance can lead to useful insight, self-reflection that have the power to remove roadblocks and push them to a treatment forward. Mainly it is advocate for their child, what is needed for their child. Acceptance starts in the family. It should go to the school, community, and workplace. Let's talk about the family. Families is essential partners in the education of a child with autism. It's when it comes into the family, it is not just the immediate family, the parents or siblings. This goes to the extended family, grandparents, uncles, aunties. So sometimes the children are when they accept the parents accept that my child has this problem, but when it goes to family get-togethers, meetings, there are a lot of questions arises, why he is behaving differently, why he is not speaking. So we need to know that this awareness, understanding, acceptance should go to the extended family as well. So the child will be accepted as what he is or she is. That will help them to grow more better. So next one is the acceptance in the school. Of course, we know that the readiness for inclusion, it is happening across the world right now. Still, there are some places it has to happen more in a more in a developed way. So inclusion for readiness, and plus there should be an individualized education plan for the child, customized behavior plan for the child, and the teachers should be supported by a Senko department, because teachers has to manage 20 to 30 children in one class. So the teachers should have an awareness and understanding that how can I help this particular child, right? So the same way, awareness should goes to the peers also, because if the peers knows that why the child is behave differently, why he is not talking, or why he cannot do this, the peers accept what is his friend, so they can help them rather than isolate him. So sometimes the children, autistic children, they are good academically, they are successful in their academic works, but they still struggle in social skills, in expressing emotions. They have poor reciprocating conversations. When this happens, they feel isolated if the teacher doesn't understand, if his friends doesn't understand, they feel isolated. So the schools, the acceptance should happen in the school. Acceptance in the community, that's another thing. If you ask an autistic individual what they wanted, they will say that they wanted to accept who they are, not like a different person, right? So they need to accept themselves. They want to understand that what they have, why they are different, right? It's not like a social norm. If there is no eye contact, so the society will say why he doesn't have an eye contact, why he's speaking but no eye contact. So this help them to isolate from the society. So they need avoidance, ignorance, prejudiced about them. Do not expect everybody to follow the norm. That is something autistic community needs. And the other one is workplace, acceptance in the workplace. So though our child learned well in the school, they went to the university, when they come to their career, what they will do? They will create more inclusive, diverse work atmosphere they needed. The company should accept them and value their contributions of their autistic employees, offering reasonable adjustments and mentoring. And so otherwise they will get harassment in the workplace. They will be judged in the workplace. So acceptance in the workplace is something we need to think about. To accept, of course, everybody should know what are the difficulties they are facing. So the autistic children have difficulties in communication, self-help skills, social interaction, academic skills. They have restricted, repetitive, and stereotypic behaviors. And when we come to the first one, the speech and communication concerns. So sometimes they speak, sometimes they never develop an oral speech. And they can speak, but they struggle with the different areas of communication, having a conversation, having initiate a conversation, having a go with the conversation, expressing their thoughts and feelings appropriately. And sometimes you know that they talk in great length about their topics, what they are interested, difficulty in understanding others' conversations, the cues from the other person, difficulty in understanding the gestures, eye contact, and facial expression of other people. So they cannot keep up the conversation, right? So how we can address the impairments in autism? Who can help them? Experts in the field, family, school, primary caregivers. How? Actively teaching them, modeling, role playing with appropriate speech patterns and language, use augmentative and alternative communication, right? So we can explain it a little further. So experts in the field means speech and language pathologists, applied behavior analysis, occupational therapy. So there are different areas we can work on. So since I am working in applied behavior analysis, I'll give some information regarding how we are working in the communication area. So we are using mostly verbal behavioral approach. It's an application based on the principles of applied behavior analysis. It relies on comprehensive understanding of function of language and offers a theoretical framework that explores the role of environment. For example, we are teaching, if it is an apple, we are teaching them to name apple, point apple when they ask to point apple, and the same time, if he wants apple, he can ask for apple. So we are teaching the language based on the function of the behavior. So how we are doing it, the therapy is conducted on a one-on-one setting in a natural setting. It can be home, school, community. It encourages children to initiate speaking by motivation. It reduces negative behaviors and develop meaningful communication. It is adapted to meet each individual's unique needs. We start in a one-on-one setting, it should go generalized into a natural setting and across people. So if the children are not talking, of course, there is other ways we can help them to communicate. So using augmentative and alternative communications, using gestures, sign language, picture and exchange communication system. There are ACC devices, Prolog to Go Talk. Many are there in the market now. When we come to the social skills, you know that autistic children can have difficulty in sharing, taking turns. Cooperation may be a difficult challenge for them. Having challenges with the social norms and nonverbal communication. They are understanding the cues, body language of other people. So this make their social skills more difficult for them. Sometimes recognizing the sarcasm, jokes, and idioms. Normally the autistic children, their thought process are coming in the white and black areas. So they either take it as a white, they take it as a black. In between the gray area, it's hard for them to involve. So mostly neurotypical people, they are talking, doing in a gray area. So, but for the autistic children, it's hard to go into the gray area in the beginning. It's so hard for them. So it's hard for them to recognize the sarcasm. And in the community, lack of interest in sometimes, some, or not all the autistic children has less interest in playing with other people. Some have a lack of interest in playing with other peers. They prefer solitary activities or unique interests they have. Some people with autism, they like to socialize, but at the same time, they don't know how to initiate a conversation, how to go along with that social norms. So they get challenges. So either way, they are getting difficulty in social space. And challenges with social norms and nonverbal communication. They may not be able to carry on two-way conversation about the same topic. Because of this social difficulties, they get social isolation, loneliness, bullying in the school, college, or in communities, increased anxiety. It can cause depression and low self-esteem. Strategies for supporting social skills in ASD. Who can do that? Educators, parents, caregivers, and peers. How? Proactive strategies, giving them awareness and taking away the stigma and misconceptions. Implement proactive anti-bullying measures to create a safe and inclusive environment for them. Where we need to start? We start with early intervention, school-based interventions, community-based interventions, making social groups, create inclusive environment that empower the students to thrive, making collaborative efforts between researchers and educators and families. Strategies for supporting social skills in ASD. So when we are talking about helping and teaching the social skills, what we are doing in applied behavior analysis, we teach the prerequisite skills which is needed for the social skills. So example, teaching them imitation skills, teaching them matching, teaching them following instructions, identifying items. These are the prerequisites needed for a play skill. The play skills or the social skills, right? So asking for items, asking for their needs. When they are prerequisite skills, we help them to work more on their play skills and social skills. Then we systematically introduce into social and play skills, reinforce the desired behaviors, and then generalize the skills into real life situations. Another challenges they have, we cannot say it's a challenge. This is one of the things that symptoms that you see it in the autistic children are repetitive and restrictive behaviors. It can be, maybe have seen it, hand flapping, body rocking, adhering to the strict routines, intense focus on the specific interests, inflexibility. Okay? How we can help go through this repetitive behaviors or treat the repetitive behaviors. Sometimes they having this repetitive behaviors or behaviors due to their sensory problems. So we need to work on sensory problems, visual cues to make the schedule more flexible. So their rigid attachment to the routines can be reduced, the anxiety can be reduced, exposed to new items and environment systematically. When you are exposing them to a systematic way, they get less anxious. They used to adapt to that situation that help them to reduce the anxiety too. And another main area which parents are normally struggle is that problem behaviors. Some examples are non-compliances, aggressive behavior, self-injurious behaviors, crying, screaming, tantrums. So sometimes when we are seeing these behaviors, we need to think about your child's specific behavior. Think about when the behavior has happened. Don't just look into one time, but we need to look into different occasions the behaviors are happening. So why does the problem behavior occur? And we need to look into what happened before the behavior, what you did after the behavior. So when you look into this A and C areas, we arrange this A area and C area. So we can manipulate the behavior, we shape the behavior in a better way. So let's look into that, what events took place, what they are trying to communicate to you. So when we go into that, what they're trying to communicate to you. Sometimes they try to access a tangible, a toy, or try to get your attention, or escape from something, escape from a situation, escape from work. Sometimes it is because of their sensory need. So sensation get from flapping his hands or picking their skin. So it can be cause of sensory issue. So we need to most often every human beings the behaviors that happen to get something or get out of something. Right. So we need to look into these functions of the behavior so we can help them. What do you want your child to instead of them displaying this challenging behavior? Teach a replacement behavior and positively reinforce the replacement behavior. The probability of occurring the positive behavior thus increases. Other areas most of the autism children have facing is self-care. So it's a showering, brushing teeth, grooming hair. So this is another area. So we need to help them. How we can help using task analysis to teach the self-help skills, use the visual supports to encourage to do the self-help skills, and also depends on age guidelines, what's the age, what that age like that. The 3-year-olds need a self-care is different from maybe a 15-year-old, right? So we need to think about what they are needed exactly and help them on it. Other areas are academics. They might have a problem with academics, reading comprehension, math, and challenges with perspective taking, problem solving. So help them acknowledging and addressing these challenges. Create a more inclusive and supportive environment for the individuals with autism. How we can do it, simply encourage social interaction, setting a play date with start with one child or a small group of children, not pressuring your child to be like compared to other people, teaching your child functional living space, allowing your child to have a personal space and downtime. How we can support the parents, have the access to the resources, giving some counseling and supporting service to address their unique needs. Autism journey is always difficult one. The questions always will come before have answers. There will be always questions, but sometimes they don't have answers too. There will be ups and downs. There will be periods of high highs and low lows, but there will be joy. There will be laughter. There will be love. Parents are their best advocates. Our duty is like autism acceptance is not a favor or a charity. It's a human right. We all need to practice and promote acceptance. And these are some resources you can check into if you want to know more information about autism. And if you have any questions, of course, we can talk about it right now. What I have one question here. What are some tips you would give parents to help their face not face issues with being accepted? Um, I didn't get the question right. You are first of you are asking not face issues with being accepted. You mean like when they are not facing, they are facing issues? I'm I'm not sure about the question. Can you explain it a little bit? Or how to face the issues? So mainly, since I am not getting any response, I'm just answering what I understand from the question. Is that parents tips for the parents is that like we are advocate for the children. Parents are advocate for their child, and we need to advocate the child for themselves too, right? So we what we can do is we need to teach them saying like is there a way parents prepare their child. Yeah, exactly, that's what I'm going to talk now. So we are preparing our child to the mainstream or to the society or for themselves mainly, right? So they are teaching them self-help skills, be making them more independent what they are doing. If they are going to the school, what are the skills where they needed for the school? What are the prerequisite skills they needed for their the level of living? So that is the way we can help them advocate for themselves. Like, so examples, the child is going to nursery, going to school. So we need to teach them following instructions, imitation skills, so mainly in the classroom. So one-on-one setting, if they are teaching them following instructions, imitation skills, and generalizing in a small setting, a small group, then when going into a nursery, so there the child is, if he is able to follow instructions and one-on-one, of course it is easy to follow instruction in a small group than in a big group. So we need to teach the skills which is needed for them to thrive in the society. So that is the way we can help them to face the issues in the society. So mainly the communication, how they can communicate their needs. So starting with the one word, adding one other word, making a sentence. So that is the way they can start communicate their needs. Does that help you? Another question, how can educators create an inclusive classroom environment that supports and meets students with autism? It's a very good question. This is something has to happen across the schools. Of course, there are many things we can do. Is first thing we need to see that when a child goes to autistic child enrolled in the school, of course, their needs are a little different from the neurotypical children, right? And it depends upon every autistic child is different from each other. So some children, they are, just an example, some children, they have no problem with the noise in the class. The crowd in the class, the children in the class, some children, they cannot tolerate noise in the class and um, the others, most of the group being in the group. Okay, so it depends upon the need of the child. The other thing is sometimes the level of the comprehension of the child, how much they understand in the classroom. When teacher is teaching, they directly understand it from the teacher or not. So that there should be an individualized education plan for the child which help them to learn according to their capacity. So the special education department in the school should help along with the teacher on this. They make an individualized education plan for the child, and sometimes like the challenging behaviors are there for the child. Well, along with this educational plan, they need a behavior plan also to help the child to express, like example, if the child having doesn't understand the things in the classroom, so he get bored, so he try to escape from the class because he doesn't know what's happening in the class and it's boring for him. So what is end up like the child is having a tantrum in the class or another behavior in the classes. Sometimes the teacher or in the classroom to make the class uh, available for other children, this child will be taken away from the classroom. What is happening is that the child is actually escaped from the class, and the child is taken away from the class because the child teacher thinks that teacher or the classroom needs a peace in the class, right? So to be not to be disrupted in the class. But child is doesn't want to do the work there. What is happening? Child gets what he wants by sending him out. So we need to know the function of the behavior. The way he is doing the tantrum to escape from the work, and the child got the escape. So we need to know the function of the behavior, why he has a tantrum in the classroom. So to know the function of the behavior, there should be some kind of behavior specialist in the schools which help them to understand that how behave in a behavioral wise they can help the child to be in the classroom. Sometimes they cannot engage all the classes and all the subjects. They may be pulled out to learn in a one-on-one setting, and again having back in the general classroom to learn along with his friends. So we need to have a great plan for the child to inclusive in the class. Adding along with that, sometimes there are special and support people are there that can help also to help the child to do better in the classroom. So there is a personal assistant for the child to go through the classroom. Here's another question. So, um, Okay, there is no more questions, so it's time to say bye. Thanks everyone for joining me today. Hope this webinar helps you a little bit. Thank you so much for attending.